Measles are making a comeback.
Now to concerns over the measles.
Growing measles outbreak.
It's gonna get worse before it gets better.
And it's not just in the US. Thousands of cases have also been reported in India, Vietnam, and Indonesia. And now travelers returning to Australia have been testing positive for the disease. So what does this mean, and should we be worried? Measles was declared eliminated in Australia in 2014. But small outbreaks still occur regularly because travelers bring the disease back from other countries where it's circulating. The concern with these growing outbreaks overseas is that Australia is currently below the World Health Organization's recommended vaccination rate of 95%. In fact, just over 92% of 2-year-old children in Australia are vaccinated against measles, and there are entire regions where the rate is closer to 70%, and even pockets of under-vaccination in inner-city Melbourne and Sydney as well. Because we're under that target vaccination rate, medical experts say Australia doesn't have herd immunity, which is when enough people are immune to a disease to stop it spreading within a community. And another risk factor is some people might be under-vaccinated if they got the jab before Australia's vaccine regime changed in the 90s. It wasn't until 1992 that the country started providing children with 2 doses of the vaccine, which is about 99% effective for lifelong protection. So the at-risk populations in Australia are babies under a year old who haven't yet been vaccinated, people who cannot or choose not to receive vaccines, as well as adults who've only had 1 dose. Now, when Australia's borders were closed in 2021 because of the COVID pandemic, there were no cases of measles. But since then, cases have been rising. There were 57 cases in 2024, and in the first 3 months of 2025, there have already been 28 cases. Though the health department notes that this year's rate is on par with 2024. So what can you do about the measles? The best thing to do is ensure you're fully up to date with 2 doses of the vaccine if you're able. You can check your vaccination records online or by asking your GP. The MMR vaccine covers other viruses as well and is free for all Australians at any age. Now, while a lot has been made about how the COVID-19 pandemic led to more vaccine hesitancy, experts say Australia's low vaccination rates are more often an issue of access, with parents either not finding the time or the money to have their children vaccinated. The government could help the situation by offering more clinics at convenient times like Saturday mornings, and continuing investment in bulk billing GPs who can provide vaccines for free.